Sounds good. Yeah, folks, we just thought we'd take the opportunity to present to our membership, and I know we only have a few here, and then this recording as well of just this part of the report on our community survey will be sort of uploaded to our YouTube channel so others can view it at their leisure. So I think everybody should be able to see it, but Linda, you're you're on.
Okay, next slide. Okay, about CAPA. I'm going to turn my camera off because my eyes are been giving me some problem, all that inflammation, which probably isn't great for me, but all right. So CAPA uses the power of information, research, and communication to help people living with arthritis find their voice and support others. We believe that the first person, the expert, we are experts in our disease. We were founded in 2002, and I was one of the founding members of CAPA. We were part of the Arthritis Society at that time, and then in 2006, we went independent and incorporated, which is why we have to do this stuff on the AGM now. We are a patient-led organization, people living with arthritis, very grassroots. We have board members and community members that we engage with across the country. And we have a really good track record of engaging with health researchers and policymakers. And our vision is a world where people with arthritis have equitable access to healthcare and treatments. And we just heard from Dr. Correa that that is slowly changing in this area of cardiovascular disease. But up until I would say I never heard of the cardiovascular disease risk until about 5 years ago. So that's a long time to be living with rheumatoid arthritis and not be aware of a risk. To participate meaningful in healthcare decision making, to work leisure, daily activities, and maintain our emotional well-being, and to contribute to and drive innovative patient-oriented research and decisions. So our 2024 priorities, access to vaccines, patient support program projects. There were many drug shortages of our medications, which is a huge issue. We've done work around medical cannabis, cardiovascular disease, and we're working on our French language translation to reach more francophone. We've also developed we've had a life hacks and assistive devices project that we've been working on with occupational therapists, youth committee that has developed some wonderful resources, our pregnancy and parenting series, living in a world with COVID-19, disability benefit consultation that we participated in, and we had a patient partner training program to try to help patients feel comfortable participating in research, influence of pharmaceutical policy and other health policies, support research and match patient partners to projects, academic publications, and we've participated in research and policy conferences.
All right,
Are you
and I'll take it from here, Linda. Thank you.
okay? Great.
Yeah. Pardon me?
Great, go for it.
All right. And I guess if you wanted a more detailed explanation as to what we've been up to, this has been uploaded to our YouTube channel, and it's just a brief 10-minute presentation by yours truly about what we've been up to in a more detailed way, and that you can enjoy at your own leisure. So, on that note, but really, I just wanted to highlight a few of the key findings of our survey that we did. We try to do these surveys annually, and really it's to get a pulse from our community directly. So people living with various forms of arthritis about what they think about what we're doing, how aware they are of some of our projects and that sort of thing, and how impactful or useful they are for people and just how they interact with us. And, it's just really important, I think, as a community-based organization to be like listening to people, right? And to reflect on this on an annual basis. So here I'm just highlighting a few of the key findings. So some of the reasons that people joined CAPA was to get educated. So it was really nice to see some new faces, for example, even earlier today at the webinar, about because people are interested in becoming more aware of their disease and how to manage it. Also, a lot want to become advocates and just to generally stay informed of things. They found us primarily through either web searches or other patient groups, as well as through social media. And I guess in terms of some of the benefits of joining, again, that access to information is super important to people, but also feeling like they're a part of the community, right? It can be really lonely, frankly, as someone who's lived with this disease, to kind of just be out there. And so I think that's just important for us to be reminded of, going forward, and thinking of our priorities for the next year. Also, there was a significant amount that want to become actively involved in, advocacy or in research and these sorts of things. So I hope that however we operate really kind of can take that 45% and match them to as many different things as possible, right? So that they can get involved. So in terms of how aware they were of some of our projects and how impactful they were, so quite a high awareness and impact really of our newsletter, which is our primary way of communicating with people. So we include all sorts of different information in there, from like the latest drug shortage to recruitment for research projects that are going on out there. So that remains definitely one of the highest impact and awareness. A lot of a bit of a mismatch sometimes between what they're aware of and what the impact is, but also quite aware of our parenting and outreach work, as well as the Make Room for Youth and projects on medical cannabis and life hacks and assistive devices. In terms of impact and usefulness, many noted the need, the high impact, I guess, of that project on assistive devices, as well as knowing more about medical cannabis. Some of the other items are noted on here as well. So again, I guess some information to take forward for our 2025 plan. In terms of our research and policy initiatives, so many are aware of some of the work we do in advocating for those who are immunocompromised, about submissions and involvement we have in research and clinical trials, as well as the education that we offer to the community, like the patient partner training program about becoming involved. There was a really high impact, seen and usefulness of some of the disability policy work, as well as, and I guess that kind of goes back to the 45% of people that are interested in being involved, right? Beyond just sort of getting information, but they, feel that work is impactful in terms of training people so they can sort of advocate on a broader level for the arthritis community. And I know this keeps coming through here, as well as our continued work on advocating for the immunocompromised, which we experience due to the many medications we take. And then looking ahead, what are some of the sort of top issues that were identified, that are of importance to our community? So access to vaccines continued to be highly rated, access to the latest research, and some frustrations there, I think, with, academic publications being paywalled, for example, just needing some practical advice on daily life and navigating healthcare and these sorts of things, as well as mental health and just more to do around building up a community, and kind of goes back to, again, what they had said sort of earlier in the survey around feeling like part of a community. And then, so what are some of the sort of health, equity issues that were important? So, some newcomer support, right, who may not be as familiar with the healthcare system here. I mean, it's complicated for us, like, when we've had to navigate it, it's just that much more challenging, right? Trying to understand all those different parts and how to get the care that you need, as well as the financial burden for paying for medications, some increasing interest in, sort of living with more rare rheumatic disease, as well as access to healthcare for people in rural and remote areas. So those were just some of the other emerging themes that sort of came out from our conversations. And so with that, I open it up to any questions if people have, but really just wanted to take this opportunity to report back. I mean, generally overall, I think when I look at the numbers, I think close to, 90% of people are satisfied with what we're doing. And these are just some more things that we need to be doing to kind of make sure that we, keep that number high. So thanks so much, everyone.